As you know, it is Breast Cancer Awareness Month, and along with diagnoses and treatment, there are many big developments in the recovery options. This week, Nancy Ward had a chance to talk with a doctor about some of them. Let's have a look.
Well, it is Breast Cancer Awareness Month, and a common treatment for the disease is the removal of breast tissue. Now, some women are even opting for the surgery, even if they have elevated risk for the disease, before they show any signs of cancer. But what options do women have after this serious procedure? Here to talk about that is Dr. Lisa Hopkins from St. Peter's University Hospital. Dr. Hopkins, thanks so much for joining us this morning.
Thanks for having me.
Obviously, a big topic. First question is, can this procedure reduce the risk of breast cancer?
Absolutely. So we do when we do a mastectomy, we remove all of the breast tissue. We can never bring a woman's risk down completely to zero, but we can get it much lower, especially in women who are at high risk.
So what are the less invasive options for breast reconstruction surgery when mastectomy is not required?
So most of the time nowadays we can actually do lumpectomies. So we can just remove the cancer itself and preserve the overall cosmesis of the breast, so the breast still looks like a breast in the end. There are still, unfortunately, some situations where our only option is to do a mastectomy.
And we were talking earlier this morning, surgery to remove the breast and reconstructive surgery, obviously big procedures. Can they both be done together?
They can.
Wow. How's that?
It's a wonderful thing that we can provide for women. That they have their mastectomy. We usually can do it in what's called a skin-sparing fashion. So we remove all of the breast tissue, but we leave their own skin there. And then we work hand in hand with a reconstructive surgeon. The reconstructive surgeon then comes into the operating room during the same operation and will actually reconstruct the breast tissue.
So how many options? I'm sure women really prefer that option, obviously. How do you get more of that information out? How can we be of help to people that need this information?
There are definitely, websites for, the plastic surgery sites. The American Cancer Society always puts information out about that as well. Most important thing is probably going to be to talk to their doctor, especially their breast surgeon, because they should have those resources and be able to get the patient in the right direction.
All important things to know, especially during this month. Dr. Lisa Hopkins from St. Peter's University, we appreciate your time.
Thank you so much.
Thanks so much.